دكتور أسامة الحضرامي intervention cardiology I was asked to present this lecture to you, which inshallah will give you some clinical aspects about coronary artery disease, and I will inshallah show you some live cases and inshallah show you example about the pathophysiology that you only going to see in this year in the books, and inshallah will let you see it in the clinical aspect and what do we see in the real life. نحاول بإذن الله يكون وقت سريع خفيف كذا. And anyone has any questions please interrupt me anytime. Okay. فأولا الصوت واضح، الأمور تمام ماشية إلى الآن، شايفين السلايد؟
دكتور
أيوة
ممكن
واضح.
ترسل لنا السلايد؟
طيب هي ما أرسلوا لكم هي ترى، أرسلوا لكم هي، أنا حسب كلام الدكتور الجدي أرسل لكم هي سلايد. Okay, طيب. Why do we care about cardiovascular diseases? ترى يا جماعة دائما وأبدا أنا أقول when we talk about cardiovascular disease, it's not only the heart, it's called cardiovascular. So heart is 50% of the system and the other 50% is the vascular system. Okay. So what's going to kill the people, unfortunately, worldwide, it's the cardiovascular disease. We are number one killer. مو إحنا يعني. Our specialty is number one killer worldwide. And if you go to the statistics, mortality from cardiovascular diseases is number one. أكثر من الكانسر ومالجنسي والحروب وإلى آخره. All right. But all the time, whether you are interested in cardiovascular diseases or you are not, you have to know the basics of the cardiovascular diseases. And no, this is what unfortunately يعني going to you need to know these irrespective whether you are in surgery in whatever specialty you are going to see, because that's what's going to happen to Allah and all of us, and also the patients are going to end up by having a cardiovascular disease. So again today, I'm not going really to go into very basics, and I'm sure you all of these have been covered well in the last in this week. But I will inshallah try to make it as clinical as I can. Okay. And I know you're second year right now. If there is something that is not clear to you, please, زي ما قلت, stop me at any time and I'll be happy to answer your question. طيب يا جماعة, if we look at the prevalence of coronary artery disease in Saudi Arabia and in our country and the Middle East in general, is one of the very high population, one high prevalence of coronary artery disease worldwide. Like anyone knows why we have a very high prevalence of coronary artery disease, cardiovascular diseases? أحد يعرف why؟ إيش السبب؟ Why we are among the high risk or high countries? Because of what? Sorry.
Bad habits.
Bad habits زي إيش؟
مثلا الأكل ما يتمرنوا
Yes, exactly.
high cholesterol, high fat.
Exactly. But because of the high risk factors, the prevalence of risk factors is very high in Saudi Arabia. So دائما وأبدا there is a very strong relation between the presence of the cardiovascular risk factor and the prevalence of the disease. So تخيلوا يا جماعة إنه diabetes, the prevalence of diabetes in Saudi Arabia is around 25%. يعني ربع الشعب السعودي population في السعودية عندهم diabetes. Hypertension is more than diabetes. All right, 26 to 30% of the population have hypertension. Smoker, high cholesterol is between 30% to 50%. So and the obesity is also in the 30% range. So that is the problem. There is the more or the higher the risk factor are prevalent in a community, the more or the higher the prevalence of atherosclerosis and coronary artery disease will happen in the future. طيب. Again, this is normal anatomy. We classify the layers of the arteries, okay? We have the intimal layer, we have the media, and we have the adventitia. Again, I'm not going into details about the component of each layer, but let me just ask this question. Out of these three layers, all right, the endothelium, the intima, the media, the adventitia, which one of them is the most important layer?
انتما.
Intima?
ايوه يعني يصير فيها atherosclerosis.
Yes, exactly. And which part of the intima in particular? ايش نسميه؟
اللي هو الاندر اندوثيليوم وسب
ايوه
اندوثيليوم.
ايش نسميه؟ We
ما
call it the
Adventitia.
endothelium. The endothelium. So out of these three layers, the most important structure that is going to play a major role in cardiovascular disease is the intima, and in particular the endothelium. والله يا جماعة أنا دائما وأبدا أقول إنه the endothelium is the most important structure in the human body. يعني everything سبحان الله has a job. كل شيء في جسمنا has a function. لكن the endothelium سبحان الله يعني is the most precious structure. أهم وأعظم عضو سبحان الله خلقنا هو رب العباد endothelium. And why is this يا جماعة? What is the main role of the endothelium? يا جماعة why it's important?
يحمي الأعضاء الداخلية مثلا زي الوول.
Okay. In English واحد كذا يقول لي it protects
Protect الأرض.
against. So it protects what? It protects the blood and the organs from the harmful substances in the blood stream. Okay? تخيلوا إنه if there is no endothelium, any toxic substances that goes into the blood is going to be absorbed and deposited in the blood vessels. Okay? Without this endothelium, I'm sure, subhanallah, no one would have lived يعني a normal or a long life. Okay? So the main function of the endothelium is to prevent clotting, to prevent atherosclerosis. Right. So what is the process? What is the process of atherosclerosis? Okay. This is the intima, all right, and this is the endothelium. Endothelium is the most superficial layer of the blood vessel that is in direct continuation and communication with the blood. Like, what is the process of atherosclerosis? How does it involve? خلينا نقول ببساطة كده سريعة. It starts with what? ايش اول شيء لازم يصير for atherosclerosis to happen؟ ايش اللي تعلمتوه هذا الاسبوع؟
هو injury of the endothelium because of
Deposition of fats.
deposition of fat. صحيح. All right. But the deposition of fat happens because زي ما قال زميلكم قبل شوية it because of interruption of the endothelium or endothelial injury. لأنه زي ما قلت if this endothelium is well maintained, if it's well functioned, nothing inshallah is going to be or to be available to penetrate into the intima and invade the blood vessel. So, but if the endothelium is damaged for any reasons, all right, endothelial injury is going to happen. So all the toxic components, the toxic substances in the bloodstream are now more than welcome to go into the layers of the arteries, and it's that process of atherosclerosis stuff. And what is the most toxic substance موجود in the blood, which starts the process of atherosclerosis. زي ما انتم شايفين هنا ايش؟ lipoprotein, lipids. Okay, so the
دكتور
lipids, yes.
سلايد دكتور معلقة على الأول اللي هو على الوضع الأول ما دخلت جوة الفول سكرين.
لحظة، الآن شايفين الرسمة حقت التايتل evolution of atherosclerosis plaque،
لا
شايفينها؟
عندها نورمال ارثري وول وعلى اليسار سلايدات رقم 1 2 3 4 5.
لا تقريبا. طيب خليني أنا أقول في شيء غلط كده. طيب. طيب في سلايد الآن شايفين؟
ايه دكتور
شايفين؟
ايوه elevation of
إيه
the
دكتور.
atherosclerosis.
evolution of atherosclerosis. ممتاز. طيب معلش إذا sorry. فإذا this is the layer of the endothelium. Okay. All right. زي ما قال زميلكم إنه there will be some endothelial injury. So some holes and pores are going to be available in the intima. So the lipid and the cell, the toxic components in the blood find a way to penetrate inside, and the most important part that is going to initiate the process of atherosclerosis of the component is the lipoprotein, the lipids. Okay, so they go into inside the layer of the artery. طيب ايش يصير بعد كده؟ يلا دخل الليبيدز. What happens after that? يا جماعة. After the lipid invade.
different cytokines.
Yes. So lipids are considered a foreign body. So whenever there is a foreign body, what will happen is inflammation. All right. So inflammation. So all the inflammatory cells, the inflammatory components are going to go and attack the lipid to get rid of the lipid content. All right. So the macrophages, leukocytes, they are going to attack and engulf the lipid material. So what will happen is the formation of the foam cell. Oceal foam cell, it's basically a macrophage that has core component or core lipid component inside it. So this happens when macrocytes attack the lipoprotein in the subendothelial space. All right. So more inflammation happens. There will be more proliferation. After that, there will be some calcification, and as the proliferation of the muscle goes and the more layers of inflammation happen, there will be progressive narrowing of the lumen until until there is something called a plaque. What is the plaque? The plaque is basically is an inner layer, all right, that is formed by the lipids, by the foam cells, by the inflammatory cells, by the platelets, all the cells that attack the core lipid component. Okay, so they form a mass, semi-mass, more or less, in the inner side of the artery. We call it a plaque. All right. So this plaque can stay there for years. All right. It can be calcified, hard, rigid. All right. And sometimes something happened to these plaques. Part of the superficial part of the plaque gets erupted because of necrosis, all right, or because of dislodgement of a part of the cell. So what happens if this plaque ruptures? The platelets and the body is going to recognize it as a bleeding site. So على طول, the platelets are going to attack this site. Platelets are going to aggregate. Platelets are going to stimulate thrombus formation, and a clot will be formed to close the hole or the gap that was created because of this rupture plaque. All right. Then this is the pathophysiology, يا جماعة. And let's now put it into more of a clinical practice. طيب. This is the شايفين السلايد هذا الثاني ها؟
ايه دكتور
normal واضح تمام. All right. So عندنا هنا 3 layers of the arteries, of the coronary arteries. All right. عفوا 3 lumens. The normal coronary artery, nice tube, no blockages, no the endothelium is clear, and now we have this atherosclerotic plaque. So the plaque is formed because of the deposition of all the lipids and all the inflammatory cells. All right, and the lumen becomes narrower and narrower. Okay, and then there is an atherosclerotic plaque with a blood clot. So there is a plaque that is ruptured, and a thrombus forms into that plaque to close the hole. So a thrombus will form. طيب. What happens to each one of them? طيب. أولا, you have to know that atherosclerosis does not just happen in a day or two. It is a very long process. أعطيكم example, مثال, and I always like to give this example just to understand the pathophysiology of atherosclerosis and coronary artery disease. سمعتوا عن condition اسمه familial hyperlipidemia؟ أحد سمع عنه؟ Familial hyperlipidemia. What is it?
أعتقد إنه انسداد في الأوعية الدموية من الدهون، وتكون أفراد العائلة يعني مشتركين في هذا الشيء.
Yes, exactly. So these people have very high lipid content because they do not metabolize the lipids. So they have very high lipid content. All right. And that's why they die early because of atherosclerosis. When I will show you some examples. Do you know at what age the process of atherosclerosis start in these people? أحد يعرف عمر كم؟ يعني هم هذو they die, الله المستعان, if they are not recognized by the age of maybe 40, 45. Do you know at what age they start to have the atherosclerosis? عشان بس أوريكم
In their
the
20s?
process. 20 years من 20 سنة.
Yeah.
طيب
Yeah.
أحد عنده توقع آخر؟
20.
30
هم؟
35.
30 35. It
9
happens in during pregnancy. All right. تخيلوا وهم في بطون أمهاتهم they start the process of atherosclerosis. Okay. فتخيلوا it takes long time for them to have. عشان كذا these people with familial hyperlipidemia, there should be no delay in their treatment. لأنه unfortunately by the time these people are diagnosed, all the nasty complications already have happened. تمام؟ طيب فإذا a progressive narrowing will happen. There is nothing يعني a human that is going to narrow all of a sudden كذا from 0 to 10 to 20 40. لا, it takes long time. All right. So more progressive and more narrowing of the lupin happen. All right. So the patient, there will be more or less blood perfusion to the organs, to the heart, to the kidneys, to the brain, and atherosclerosis, and then heart attack happens, myocardial infarction or stroke, transient ischemic attack, or even peripheral vascular disease, limb ischemia happen after that. Okay, لكن my focus today with you is to focus in the coronary artery. لكن دائما وابدا يا جماعه لا تفصلوا ما بين coronary artery disease and atherosclerosis. دائما وابدا the presence of one atherosclerotic event is a predictor for the other disease. مثال, if someone has had a stroke at the age of 40 مثلا, at this we call it يعني we call it premature atherosclerosis. Okay, this, although أنا as a cardiologist, this patient didn't have a stroke or a coronary artery disease before, but I consider the stroke that he had is equivalent to the coronary artery disease. And as يعني because if a blockage happens in one artery, it means the patient is at high probability of having a blockage in another branch. Okay, طيب راح تشوفوا الاكزامبلز هذه, the arteries of the heart, the right, how do we divide the arteries of the arterial supply of the heart? Two main arteries, the right coronary artery اللي بالازرق, and the left main coronary artery. All right, the right coronary artery supplies which structure? The right ventricle, and it supplies the inferior wall of the left ventricle. All right, the left main coronary artery is divided into the left anterior descending artery, which goes inside in front of the heart, and the left circumflex artery, which goes into the lateral aspect of the heart. Okay. Like, so the cardiac muscle always depend on aerobic oxidation. All right. Unfortunately, the muscle or the myocardium has no anaerobic oxidation. All right. So it depends on oxygen. It doesn't survive on anything other than oxygen. So the cardiac muscle has the highest O2 uptake compared to other tissues. And some other tissues, say the other skeletal muscle, for example, they might survive with anaerobic oxidation. All right, but for the heart, oxygen, it's either oxygen or none, as simple as that. Okay. So oxygen demand, so anything that increases the demand, all right? So like if you exercise, if you exert yourself, you're going to need more oxygen to the myocardium. So what happens and how does the body do that? So it increases the coronary blood flow, it decreases the venous oxygen reserve, and it delivers the maximum amount of oxygen from the myoglobin. All right. So all the time you think about when you talk about oxygenation and oxygen supply to the heart, it's always like this: artery, vein, and blood. Because, for example, if we have, for example, a patient with severe anemia, all right? Patient with severe anemia can have anginal pain with exertion. Why is that? Not that because they might have, yes, coronary artery disease, but in the, خلينا نقول, the presence or the absence of coronary artery disease. Why would they have symptoms of angina? The reason is because of low hemoglobin. All right. So anything that decreases the oxygen delivery to the myocardium is going to induce angina or ischemia. All right. Like this is the conduction system of the heart. Again, I'm not going into details. لكن I always say يا جماعة دائما وأبدا, whenever you look at the conduction system of the heart, just be careful that these structures, they also depend on blood supply. So if there is a blood supply problem to the myocardium, not the only thing that is going to happen is that the blood supply, the myocardium will be necrosis or some walls are going to die. No, it's also the conduction system. فسبحان تخيلوا, someone with coronary artery disease might not only have problem with myocardium, but also can have electrical problems. وهذه we will talk about it in the future. مثلا the risk of ventricular arrhythmias and so many things. Okay. So the ECG trace, inshallah, we'll be talking more and more in the next few years. The QRS, P wave is the first positive wave, and it represents atrial depolarization. QRS, so Q, it's negative deflection, R is the positive deflection, S is the second negative deflection. All right, and this represents ventricular depolarization. And after that, we have the T wave, which represents ventricular depolarization. خليني أسأل يا جماعة سؤال سريع كذا. Which atria depolarizes first? The left or لا, خليني أقول the QRS, all right, that you see in the ECG, it represents ventricular depolarization. سؤال. Ventricular depolarization of which ventricle is represented by the QRS?
Left ventricle.
Both.
Both?
Both.
ولا left? Yes, أحسنتوا. It's always both. أحسنتوا. طيب, which ventricle depolarizes first, the right or the left?
Left ventricle.
أحد يغير؟
Together.
لا يمكن they depolarizes together. لأنه if they depolarizes together and repolarize, أيوة, they never depolarizes and repolarizes together. هذه نعمة من الله. بعدين ممكن نتكلم بس why؟ تفضلوا. ها. right ventricle, كأني سمعت أحد يقول right ventricle. ليش؟ صح. Why the right ventricle depolarizes first? الالكتريكال اكتيفيتي الامبلس تيجي من فين يا جماعه؟ sinus node, صح؟ sinus node goes down to the AV node. All right. The right side, the right ventricle and the right atrium is closer to the sinus node. قريب للطريق السريع حق الالكتريكال اكتيفيتي. All right. For most of the right side depolarizes before the left side. Like, وعندي another reason why the left ventricle depolarizes later. Which one is bigger, the left or the right ventricle?
left ventricle. Left.
Yes, exactly. For a lot of myocardial cells, it's very thick, very complex structure. It takes a lot of time to depolarize. For everything in the right side depolarizes before the left. فإذا دائما وابدا يا جماعة when we talk about P, it is depolarization of right and left atrium. QRS is depolarization of right and left ventricle. طبعا السؤال هنا it reflects which depolarization. الجواب طبعا it is more of the left ventricular depolarization. ليش؟ لأنه it's the thicker, it's just going to generate more of the PQRS. بعدين هذه إن شاء الله we'll talk more about it in the ECG. So risk factors for coronary heart disease, we have the modifiable and non-modifiable risk. So non-modifiable, the sex, so males and females, age, and the family history. هذا اللي تكلمنا عنه, family history of premature atherosclerosis. All right. طيب, why do we differentiate between males and females يا جماعة? I'm sure you know this very well. Huh?
لأن الإستروجين يعتبر أنتي كارديوجينيك.
Yes, exactly. So women during menopause, they are protected because of the presence of estrogen and the hormones. So they are protected against atherosclerosis in general. Okay? Like, عشان كذا يا جماعة, when you have a family history of atherosclerosis, we call it premature family history of premature atherosclerosis. What is that? What does that mean? It means that if an atherosclerosis happens at early age in males and females. طيب, متى نقول إنه premature or early atherosclerosis in females؟ بعمر كم تقريبا؟
Before 50 or 55
اللي
or
هو
55.
before the age of menopause. Exactly. Yes, exactly. فإذا any atherosclerotic event that happens in a female patient at or within the menopausal period, this is considered risk factor for atherosclerosis. Why? لأنه the patient should be protected because of the estrogen and the hormones. So why did this lady have a stroke or atherosclerosis? It means there is a genetic predisposition or maybe there is a familial hyperlipidemia. Okay? Like at male, which age? طيب, ما راح اجاوبكم. هذه نقطة ضاكم انتم طلعوها لما تقروا الماتيريال ان شاء الله اليوم. Alright? So what is the cutoff age for premature atherosclerosis in males and females? تعرفوا الايج كذا كم وهذا الايج. anyone has a question يعني او تلاقي جواب او ما فهمه, please يتواصل معي على الواتساب وانا I welcome any question. ماشي. طيب, we have the modifiable risk اللي هي smoking, stress, hyperlipidemia, obesity, diabetes, hypertension. طيب, smoking, why smoking happen? Why it's smoking? What does it do? يلا بسرعة سريعا. ها.
يزيد لي hypertension.
All right. طيب, والhypertension what does it do? ايش يعمل؟
يسبب لي like construction وبعدين يسبب لي injury ممكن.
Yes, exactly. يا جماعة الهايبرتنشن والسموكينج والهايبرتنشن والهايبرتنشن والسموكينج, تمام, كلها هذه وتحديدا الهايبرتنشن. تعرفوا الحفار هذا اللي يحفروا فيه في الشارع؟ alright, تعرفوا الدريل هذا اللي يحفروا فيه, اللي يحفر في الحفريات, هذا هو بالضبط. it damage the endothelium, فيصير الاندوثيليال injury. stress, why emotional stress وال يعني mental stress might be a risk factor for atherosclerosis. What does it do? من كل البروسيس حقت الاثيروسكلروسيس، يلا بسرعه يا جماعه. What does it do?
Overactivating of sympathetic system.
يا سلام، exactly. So it increases the inflammation. احسنت. Yes. بالاضافه انه الستريس don't forget انه it increases the risk of hypertension as well. So it increases the demand on the heart, tachycardia, increases the blood pressure, increases the inflammation. All right. Hyperlipidemia خلاص واضح. الobesity, what does it? Diabetes يلا سريعا. What does it do? diabetes يعمل كل شيء في الأثيروسكلروسيس. It increases the lipid component. It damages the endothelium. All right. And also the deposition of all the toxic materials in diabetes, it triggers the inflammation and so on. All right. So obesity, etiology of obesity, there are diseases or non-diseases, primary or secondary خلينا نسميها كده. All right. So age risk factor for obesity, females particularly, menopause, genetic, sedentary lifestyle, junk foods, alcohol, depression, mental disorders, medications, and so on. طيب, how people with coronary artery disease present? These are the most common presentation of patients with coronary artery disease. What do we mean by silent? يلا يا جماعة سريعا نخلص بسرعة كده.
إنه ما يحس فيه.
They can't talk.
Yes. طيب, silent أحسنتي بالضبط زي ما قلتي. They come without a complaint. زي ايش؟ أحد يقدر يقول لي سيناريو؟ مثال، مريض يحس بشوية تعرق كذا، خمول، هبوط في الجسم، دوخة، very non-specific symptoms. يروح على ER، يكون عنده abnormality في examination، نعمل ECG، نلاقي ischemic changes في ECG، أو sometimes في عندنا blood test we do it to detect myocardial injury and comes back positive. أحد يعرف إيش الماركر هذا؟ إيش اسمه؟
troponin T.
يا سلام، أحسنت. يس، يا كثرهم جننونا حقون ICU في الإمرجنسي بالإليفيتد ليفل of troponins. كثير من البيشنت يجوا for non-specific problems ومع الأسف يتعمل لهم troponin levels it end up يعني it comes positive or elevated. All right. فأحد يقول لي who are these people؟ مين اللي ما يكون عندهم typical presentation of ischemia وangina؟
diabetes ممكن.
diabetes صح. why؟ أحسنتي.
ممكن النيرف عندهم مو مرة
Yes, ما شاء
مستجيب.
الله. Perfect. أحسنتي. Perfect. Because of autonomic neuropathy. They don't have a normal neurological اللي هو sensory supply. All right. So these people do not present with typical anginal pain. ماشي. فالelderly, all right, diabetic patient, these are the two groups of people who present with very silent or a very unusual presentation. Stable angina, all right. These are the people who are going to complain from retrosternal chest pain. We'll be talking about it. Acute coronary syndrome, ST elevation MI, unstable angina, non-ST elevation MI, heart failure, all right. So not that a patient comes in with typical ischemia or angina or myocardial infarction. Instead, they come with a complication of coronary artery disease, which is reduction in systolic function of the heart of the left ventricle, and accordingly, their main presentation is heart failure. So these people, they present with pulmonary edema, with dyspnea or orthopnea, and then when we work these people up, we find that they have مثلا a missed anterior wall MI or non-ST elevation MIs and so on. الريثميas ليش زي ما قلنا قبل كده انه the electrical conduction system depends on blood supply and of course sudden cardiac death. Okay, so anginal pain, the site of the anginal pain is usually central in the chest, so anything in the left or the right side makes it very unlikely to be anginal pain. Radiation to the left, right, both shoulder and neck. طيب يا جماعة سؤال نحب دائما أسأله بالذات في الكلينيكال years. لو عندكم 3 patients, all right, all of them have retrosternal chest pain. واحد منهم يقول the pain radiates to the left shoulder, الثاني يقول the pain radiates to the right shoulder, والثالث يقول the pain radiates to the right and left shoulder. Which one of them has the highest likelihood ratio of having anginal pain?
left
مين
left
مين
shoulder shoulder
مين؟ تفضل معليش مرة
left
ثانية.
shoulder.
left shoulder. أحد عنده إجابة أخرى؟ ومين بعده؟ left بعدين بعدين إيش؟ both بعدين right.
الرايت.
طيب الجواب totally، ولا أقول لكم عشان أكون بس عشان الوقت هذا أبغى أساعدكم حقيقة. أنا I always encourage the student to read، لكن أبغى بتوصى بكم صراحة إلى هذا الوقت وأنتم ما شاء الله مقاومين، ف I will help you with this. So the highest or the most specific radiation for anginal pain is when a patient comes complaining from retrosternal chest pain that radiates to both shoulders, so right and left at the same time, followed by تخيلوا the right shoulder followed by the left shoulder. تمام؟ طبعا commonly احنا عندنا، انا اقول هذا الموضوع دائما يعني not just to show the difference between what specific radiation is and the most common radiation. The most specific radiation اللي هو قلت لكم عليه اللي هو right and left followed by the right and followed by the left shoulder. Okay, فدائما وابدا this is the يعني هذه this is just a classical teaching، وهذا this has been looked at before with studied, well documented. It's just an interesting observation. Character of the pain is usually constricting, compressing, pressure. البيشنت يقول كأنه في شيء جالس على صدري. أول ما تسمعوا هذا الديسكربشن يا جماعة take it very serious. Okay, whether you see a patient أو حتى أحد في الفاميلي عندك إنه I feel there is something sitting in my chest. All right. Severity can be vary according to the pathology, pathophysiology. Precipitated by exertion. Why it's precipitated by exertion? أحد عنده جواب؟
Increase the demand of the heart.
Yes, أحسنت. Yes, exactly. And زي ما قلنا atherosclerosis doesn't happen كذا all of a sudden. It takes time, and the human progressively worsen. ممتاز. Or narrow progressively with time. Duration and why relieved by rest?
Increase the demand of the heart.
Yes, أحسنتوا. Yes, exactly. Associated symptoms and so on. طيب الآن إيش الفرق ما بين هذه البيكتشر الصورة وهذه الصورة اللي هنا؟ هذه اليومن إيش الشيء الأسود هذا اللي جوا؟ هذه ثرومبس. تمام؟ هذه ثرومبس. هذه ثرومبس داخل اليومن. هذا كروس سكشن في اليومن. إيش الفرق بين اليومن هذه واليومن هذه يا جماعة؟
الليفت incomplete والرايت complete.
يا سلام. فإذا when there is a complete occlusion of the artery by a thrombus or coronary artery by thrombus, this is going to cause what we call ST elevation myocardial infarction. لأنه عندنا thrombus that includes the artery. ماشي؟ طيب. If there is just progressive narrowing of the lumen, تمام? This is going to cause angina. طيب, if there is a thrombus, صار عندي شوية plaque that has ruptured, جو البليتلت والثرومبس عملت شوية ثرومبس بس ما قفلت اليومين completely. صار عندي شيء نسميه non-ST elevation myocardial infarction. ايش الفرق بين النون ST elevation MI والST elevation myocardial infarction؟ الفرق بينهم انه الST elevation MI there is a complete thrombus formation. قفلت كل اليومين. Non-ST elevation there is a thrombus, there is infarction, all right, but there is incomplete narrowing or incomplete occlusion of the lumen. تمام؟ هذا هو الspectrum of coronary artery disease. إذن the patient is just going to have progressive narrowing of the lumen and the patient is going to present with angina. If there is a plaque rupture, a thrombus will form. A thrombus, if it occludes the lumen completely, it's going to cause ST elevation myocardial infarction. If the thrombus partially occludes the lumen, then it's going to present or cause what we call non-ST elevation myocardial infarction. طيب ايش هو الاس تي elevation اللي نتكلم عنه يا جماعه؟ ايش هو الاس تي elevation؟ هذا هو الاس تي elevation. All right. So when we talk about ST elevation myocardial infarction is the ST segment. So قلنا احنا دائما the first negative deflection في ال QRS اسمه ايش يا جماعه؟ Q R
Q.
يطلع الار بوزيتيف، بعدين فين الاس؟ المفروض تكون في اس هنا تحت، ما هي موجوده، ما في، وطلعت معايا سيجمنت مع التي ويف، فصار هذا البيشنت عنده اس تي elevation. اذا الار الاس اتسحبت طلعت مع التي ويف ونزلت تحت. طيب كيف نعرف انه هذا في اس تي
دكتور.
elevation ولا؟ اتفضل.
الديجوكسين توكسيستي ما تكون تشبه هذه الاستي الفيشن؟
خليه إيه، لا 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 هذه خليها بيريكاردايتس ممكن، مو ديجوكسين. هذيك الديجوكسين يعمل اس تي ديبريشن مو اس تي elevation. البيريكاردايتس كان كوز اس تي elevation صحيح. تمام. فاذا كيف اعرف هذا البيشنت عنده اس تي elevation؟ اولا you look at the ST and you compare it to the baseline. طب ايش هو البيسلاين اللي that I'm going to compare علشان اقول في ST elevation ولا ST depression؟ الجواب ال PR segment. ال PR segment. So the segment that is in between the P and the beginning of the QRS. فاذا هذا الويف هذا اللاين is the PR interval. فاذا هنا ST segment طالع فوق. This is ST segment elevation. All right. So this is what we call the ST segment elevation, non-ST segment elevation, and the anginal pain. Another interesting phenomena, it's called prinzmetal angina. أولاً, it's an anginal pain. So it is retrosternal, exertional, relieved by rest of nitroglycerin. All right. لكن it doesn't happen because of progressive atherosclerosis or narrowing of the lumen of the artery. How does it happen? It happens because of coronary vasospasm. Okay, coronary spasm, coronary spasm. All right, so the artery goes into spasm, so it delivers less amount of blood. So less amount of blood, more hypoxia, and the patient is going to have myocardial ischemia, and then accordingly it increases the patient present with angina. طيب, إذا prinzmetal angina دائما وابدا it's very difficult to diagnose لانه you need to correlate the ECG to the presence of spasm. فعادة احنا we diagnose it only in the cath lab when we do coronary angiogram. Okay. مع انه a lot of يعني evidence now is suggested that these people have microvascular dysfunction and they have some microatherosclerosis. لكن this is the entity that you're probably going to read about when you read this topic. Unstable angina is characterized by one of the following. All right, so it is a retrosternal chest pain that comes with minimal exertion and lasts more than 20 minutes. So لما يكون الانجينال pain lasting more than 20 minutes, this is not just stable angina, this is unstable angina. لأنه if it was stable angina, the pain should last only زي ما قلنا 1 to 5 minutes maximum. All right, so severe or frequent new onset angina within 1 month. So any angina that is within of 1 month of onset, this is called or recognized unstable angina. And it's anginal pain that increases in pattern. بمعنى ايش؟ البيشنت يقول لك والله عندي ألم في الصدر يجيني مع الحركة. طيب يجلس قديش؟ يجلس معايا دقيقة. إذا ما جلس 20 دقيقة. ف this is not criteria. هل هو شديد؟ لا والله مو شديد. طيب له كم معاك الألم؟ والله له معايا من 4 شهور. إذا this is not within 1 month. طيب هل الألم قاعد يزيد عليك يعني يتكرر عليك أكثر من اللازم؟ اي والله دكتور قبل أسبوع كان الألم يجيني مرة في الأسبوع. الآن الألم صار يجيني كل يوم. إذا this is crescendo pattern of angina and this is recognized as unstable angina. So one criteria is enough to diagnose angina. فإذا this is unstable angina يا جماعة وهذه how do you diagnose it? Okay, so the symptoms, the signs هذه وتكلمنا عنها, the associated findings. So physical examination, blood pressure, always check the blood pressure because the patient might have two things, might either have high blood pressure and accordingly you know what is the cause of ischemia or myocardial infarction, for example, or patient might have hypotension as a complication of myocardial infarction or ischemia. All right. S4, why people with angina have S4 or myocardial ischemia have fourth heart sound. طيب أنا هذا السؤال أحب أسأله، خلوه اللي يبغى يجاوب يعني يدور على الإجابة. why S4 might be or one of the signs of acute myocardial ischemia. انتوا درستوا الهارت ساوندز ولا لسه؟
لا الأسبوع الجاي إن شاء الله.
ممتاز خلاص، لأنه أنا هذا السؤال دائما أحب يعني أسأله للطلاب اللي في الكلينيكال years. S4 what is the relation between S4 and myocardial ischemia؟ فإذا درستوا الأسبوع الجاي وعرفتوا لأنه والله it has a very interesting relation between myocardial ischemia and S4. يعني you will understand a lot of pathophysiology. أنا always all the time يا جماعة أسهل شيء واحد يعطيكم محاضرة ويخلص بسرعة، لكن always try to understand pathophysiology. لأنه this is what إن شاء الله help you to understand the disease and will make you a better doctor in the future. Signs of hyperlipidemia and so on. طيب, management of angina is basically you need to manage the atherosclerosis. All right. All the components that we talked about in the process of atherosclerosis should be addressed to manage patient with angina or with atherosclerosis. All right. So treatment of any precipitating or a treatment of any risk factor. So if the patient is hypertensive, you control the blood pressure. Diabetes, you control diabetes. All right. Obese, you ask a patient to cut weight. Sedentary life, and so on. Like medications. These are the list of medications. والآن عشان I want to يعني ask each question عفوا medication, and I'm going to ask what is it going to treat in the atherosclerosis. يلا aspirin. What is it going to treat? Yes, exactly. So less platelet aggregation. أحسنتم. فless platelet aggregation. So if a patient has a plaque, all right, or even if the plaque rupture, all right, you give antiplatelet therapy, so you block the platelet from formation. ممتاز. clopidogrel. أحد سمع عن clopidogrel? Okay, clopidogrel is another antiplatelet therapy. Why? We give, it's another antiplatelet therapy, and we know that the combination of aspirin and clopidogrel, or the two antiplatelet therapy, will potentiate the effect of a platelet inhibition and improve the survival in patients with acute myocardial infarction. Okay, عشان كذا we like to give them two antiplatelet therapy. طيب, low molecular weight heparin or unfractionated heparin. Anticoagulation. Why do you need anticoagulation in these people? Huh? What is it going to treat in the atherosclerosis?
Prevent the from
yes,
formation?
Exactly. Yes, exactly. All right. So the process of anticoagulation, so that you inhibit the platelet with the antiplatelets. The platelets are going to cause a thrombin or thrombus formation. So that's why you give anticoagulation to prevent any clot, future clot formation in the area that has plaque, where there is a plaque rupture. Like lipid lowering medications. Why?
Because they have hyperlipidemia.
Yes, أحسنت. إذا you lower the lipid component. وش كمان؟ في أحد يقدر يقول لي lipid medication also they have another rule in atherosclerosis. والله ده لو أحد يجاوبوا راح يعني ما شاء الله يكون ممتاز.
Prevent the injury of the endothelium.
Okay, how?
Because the lipid it's cause injury of the endothelium, so I will prevent by reducing the LDL.
طيب هو it's an anti-inflammatory mechanism. Statins in particular, they have been shown to decrease the stress and lower the inflammatory process. So that's why they also prevent or they treat they are useful, helpful يعني, or should be considered. لكن طبعا زي ما قلت انت, the main thing is to lower the lipid. طيب, nitrates. Why nitrates are good if there is symptom of angina or cardiac disease? ليش?
Vasodilation.
صح. So what does it do? So it helps with what?
Increase the blood supply to the heart.
Yes, exactly. So increase myocardial perfusion. So increase oxygenation or deliver the oxygen to the body, to the myocardial cells. Exactly. Like beta blockers. يلا.
bradycardia.
طيب ايش صار اذا اعطيتي and it causes bradycardia? How they are
Decrease
going
oxygen demand.
Yes, exactly. Decrease demand. أحسنت. Decrease demand. Calcium channel blocker. طيب, calcium channel blocker عندي two types of calcium channel blocker اللي هو dihydropyridines and non-dihydropyridines. Dihydropyridines, they also lower the heart rate, so they decrease the demand. And we have the non-dihydropyridine, calcium dihydropyridine. They cause vasodilatation all right? So they improve the myocardial perfusion, all right? The non-dihydropyridines, they lower the heart rate, so they decrease the demand. dihydropyridines اللي هي زي الاملوديبين والنايفيديبين، والنون-dihydropyridines اللي هي زي الفيرابامين والديرتازين. And now we go to the percutaneous coronary intervention and coronary artery bypass surgery and so on. هذا تكلمنا عن الاي سي جي. This is what anginal pain looks like. ايش رايكم؟ Patient حاط يده في النص. So where is the pain? In the retrosternum, in the center of the chest. شايفين ايش؟ What is this? Sweating. Why the patient is sweating? يا جماعة, why there is sweating? People with acute myocardial infarction, why they might have sweating, profuse sweating?
sympathetic activity.
Because of the pain.
لا, sympathetic لا, العكس. It's because of the vagal nerve, all right? Vagal stimulation, okay? Vagal stimulation. So these people, they get vagal stimulation, they are going to have cold, clammy skin, all right? Feel dizzy, all right? And this can happen particularly in patients with inferior wall myocardial infarction, when they have a lot of bradycardia because of the bradycardia because of the high vagal tone, okay? So,
دكتور
إيه.
ليش الفيجاس نيرف يشتغل هنا؟ مو المفروض انها حالة طوارئ يعني sympathetic يشتغل؟
طيب احنا the patient, do you know what stimulates? One of the biggest stimulants of vagal nerve in the body, أهم stimulant for vagal nerve is هو any kind of pain, all right? Any kind of pain, all right? With headaches, with abdominal pain, with any kind of pain, vagus nerve stimulates, all right? Is stimulated. تمام؟ This is part of the physiology or the pathophysiology, that in acute presentation, the vagus nerve is stimulated. All right, why vagus nerve is stimulated? To overcome the stress that happens with the acute myocardial injury. All right, with the acute myocardial injury. Okay, عشان كذا these people with the acute myocardial infarction, they have nausea, sweating, and vomiting. هذا البيشنت احيانا في الكاث لاب يجونا البيشنت الله المستعان احنا we are struggling to open the artery and they keep vomiting because of the stimulation of the vagus nerve. Okay, so differential diagnosis chest pain. So as we said, acute coronary syndrome, pulmonary embolism, aortic dissection. Anyone knows what is aortic dissection? So it is a tear in the ascending or in the aorta, ascending or the arch or the descending aorta. It presents retrosternal chest pain, but it's typically tearing pain and goes to the back. Okay, myocarditis, pericarditis can cause similar chest pain. Tension pneumothorax, it is usually localized to the site where there is a pneumothorax. Pericarditis, GERD, pleurisy, musculoskeletal pain, costochondritis, all of these are differential diagnosis of chest pain, or differential diagnosis of anginal pain. طيب, therapy, medical therapy, اتكلمنا عنه. We will go to the percutaneous coronary intervention. We talked about the actions, كويس, medications and the indication. bisoprolol is beta blocker, nitrate is aspirin, ticagrelol is also another antiplatelet therapy, and we go now to the PTCA آخر the last part في presentation. طيب الآن يا جماعة I want you to show you some examples of cases to understand كل الباثوفيسيولوجي how these people present. تمام؟ هذا ال right coronary artery, all right, right coronary artery. ماشي؟ خلينا نروح على طول. طيب this is what we call the intravascular ultrasound of the artery, so coronary artery. هذه we go inside the coronary artery with an ultrasound probe that goes into the artery. تمام? And we visualize the artery from inside. All right? فإذا the dark area, black area, sorry, this is the lumen. This is where the blood is. فإحنا we are inside the artery. فكل شيء أسود, this is the blood. Why it's black? لأنه it does not, the blood does not gain or does not absorb the waves, the ultrasound waves. تمام؟ طيب إذا خلصنا the black كله, this is blood. طيب شايفين الدائرة هذه؟ شايفين الدائرة هذه؟ هذه this is the coronary artery. إيش الشيء اللي أنتم شايفينه ما بين البلاك اللاير البلاك والبلاك اللي جوا؟ البلاك لاير هذه الخارجية إيش اسمها؟ الادفنتيشيا. يس ادفنتيشيا exactly. والاندوثيليوم هذه اللي جوا. إيش شايفين هنا؟ إيش رأيك؟ يس. إيش الفرق؟ شفت المسافة ما بين الاندوثيليوم والادفنتيشيا هنا؟ شايفين الأرو يا جماعة؟ شايفين الأرو ولا ما أنتم شايفينه؟
إيه واضح.
مقارنة ما بين السبيس اللي ما بين الاندوثيليوم والادفنتيشيا. صح؟ شوفوا هنا مثلا مسافة يكون مثلا 2 ملم، هنا نص مليمتر تقريبا. ف what is this? What is this? This is the atherosclerotic plaque. هذه شكلها. All right. ف this is what the atherosclerotic plaque شكلها لما نعمل intravascular coronary ultrasound. تمام؟ هذه حالة ثانية نفس الشيء. All right. البلاك هذا البلد inside. This is the lumen. الدائرة الكبيرة الادفنتيشيا. شايفين البلاك جاية هنا على الساعة ما بين تقريبا الساعة 6 إلى الساعة 3. هنا another fibrous plaque. فشفتوا كل this is the process اللي تكلمنا عنه والأثيروسكليروسيس. This is a fibrous plaque. طيب الآن راح أوريكم coronary angiogram. قبل ما أوريكم coronary angiogram I want you to know the right coronary artery. لما ندخل جوا إيش فكرة الcoronary angiogram؟ وفكرة coronary angiogram is we go to the coronary artery either from the femoral artery or from the radial artery, and we go with catheters. ندخل الكاثيترز جوا all the way to the arteries of the heart, and then we go inside the arteries. We inject dye inside the arteries ونشوف الارتري under the fluoroscopy. And the right coronary artery normally it looks like this. شكل زي حرف السي تقريبا. alright شيء حرف السي. شوف تقريبا هذا الرايت فين الرايت؟ اي شايفين الرايت كورونري ارتري بالازرق هنا زي حرف السي. تمام؟ هذا هو نفسه تقريبا اللي هنا، هذا هو نفسه حرف السي. تمام. الآن راح أوريكم coronary angiogram. تمام. فإذا البيشنت هنا has very nice RCA. هذا الرايت coronary artery يعطي small RV branch، والارتري اللي نازل تحت هذا هو posterior descending artery PDA. alright، اللي هو نهاية الرايت coronary artery. طيب حلو، واضح الآن؟ شفتوا السي كيف شكلها؟ يلا نروح هنا. يلا، هذا بيشنت بين السي، هذا الكاثيتر، هذه انبوب القسطرة هنا داخل في الرايت coronary artery، وآي injected contrast في الارتري، فالرايت فاتح، شايف الارتري هنا، وبعدها الارتري فين؟ الارتري قفل. all right. What is the presentation of this patient؟ ايش تتوقعوا هذا البيشنت جاي؟
severe chest pain.
chest pain صح، بس ايش السبيكترم؟ هل هو جاي بانجينا ولا ST elevation MI ولا non ST elevation MI؟
elevation MI.
Yes exactly. ليش؟ لأنه the right coronary artery اللي المفتوح يكون فاتح زي كذا مقفل completely. تمام؟ مقفل completely. alright. فايش نسوي؟ فهذه this is what we call primary angioplasty. alright. فإذا we go take the patient to the cath lab، فعلى طول نروح نعمل ايش نسوي؟ we go inside the artery، we pass wire، السلك الأسود هذا شايفينه؟ تمام؟ ندخله جوا الارتري and it goes through the. ايش اللي قفل الارتري هنا يا جماعة؟ ايش اللي قفل الارتري؟
fat deposition.
فات ولا ثرومبس ولا بليتلت؟
thrombus.
Thrombus.
yes exactly thrombus. We pass wire through the thrombus، it goes all the way inside، وبعدها شايفين هذه اللي تنفخ، هذه البالونز والستنت. we go through the artery ونبدأ نفتح الارتي بالبالونز والستنت، وفي النهاية يطلع عندي شكل الرايت coronary artery زي كذا. alright. شايفين؟ this is the right coronary artery الآن فاتح، and this is the posterior descending artery. okay. شايفين؟ فإذا this is the ST elevation myocardial infarction. patient جاي بانفيريور wall MI. اوكي. طيب هذا البيشنت كويس انه في المدينه هنا على طول اخذناه على الكاث لاب. اذا ما في كاث لاب وما احنا قادرين نعمل له انجيوبلاستي، ايش ممكن تعطوه؟ medication to. لا صح you give له، لكن you need to give thrombolytic therapy. ليش thrombolytics؟ لانه to dissolve the thrombus that is in the right coronary artery. ماشي؟ طيب واضح؟ فإذا this is spectrum of coronary artery disease. يلا الآن راح أوريكم the different spectrum. هذا الليفت main أو الليفت coronary artery system، هذا هو الليفت main system، الليفت main branch. تمام. الصغير هذا يتفرع إلى two branches، اللي فوق طالع اسمه left anterior descending artery، وينزل إلى تحت، وعندي left circumflex artery اللي ينزل تحت من الليفت مين. إذا الليفت مين برانش يطلع left anterior descending فوق وينزل تحت على الليفت circumflex artery. يلا شايفين الليفت مين كيف شكله ما شاء الله بلاك نظيف، والليفت سيركمفلكس نظيف. يلا الآن هذا البيشنت باكم تقولوا لي ايش اللي صاير معه، او فين البلوكج اللي عندي. يلا امسكوا الليفت مين. ايش رايكم الليفت مين؟ هذا الليفت مين هل هو كامل زي كذا كبير ولا سمول؟
سمول.
بس سمول. هو شوفوا جاي كبير من هنا وبعدين يضيق يصير زي الشعرة، صح؟ وتطلع منه تو ارتريز، السيركمفلكس هذا اللي تحت والليفت anterior descending artery اللي فوق. فإذا الليفت مين عنده severe stenosis. alright severe stenosis. إذا هذا البيشنت يا جماعة alright أولا طيب إيش رأيكم في السيركمفلكس ارتري هنا؟ ايش رايكم؟ ايش رايكم في الدايمتر هذا مقارنه بالدايمتر؟
كأنه كويس بس المنطقة هذه صغيرة.
يا سلام عليك، احسنت. خلاص يلا نشغلك معنا ان شاء الله في كاتلاب. اكزاكتلي. فعنده ناروينج هنا. فاذا هذا البيشنت عنده severe left main artery disease، عنده severe left circumflex stenosis، تمام؟ وكمان عنده في left anterior descending artery في the branch in the beginning of the left anterior descending artery عنده severe atheroma. اوكي؟ فهذا البيشنت مع الاسف has severe left main coronary disease, severe multivessel disease. Unfortunately, these people, we do not treat them with angioplasty. The best treatment for these people اللي هو يتعمل لهم open heart surgery. وهذا اللي صار مع البيشنت. هذا الحالة سبحان الله قبل 4 أيام جاني في المستشفى. What is the presentation of this patient by the way? MI ولا angina؟ إيش رأيكم؟
MI because it's completely blocked.
فكر مرة ثانية. إحنا أولاً ما في complete blockage.
صح، لا مو complete block.
أيوة انتبه، لأنه لو كان complete block كان إيش؟ كان كل شيء مقفل.
أيوة
أنت
صح.
هنا block عندك تقريباً 95%. فإذا this presentation is anginal pain. هذا البيشنت yes typical unstable anginal pain. diabetic patient مع الأسف. وجاي يقول لي قبل 3 شهور الانجينال pain كان يجي له once daily، والآن he gets this anginal pain almost every 2-3 days with very minimal exertion. طبعا this was done ولكن he will go for bypass surgery. this إن شاء الله يا غالبا بكرة أو السبت. فإذا coronary artery disease can be treated medically, can be treated percutaneously with coronary intervention and also surgically by open heart surgery. أخيرا يا جماعة نتكلم عن cardiac rehab. The concept of rehab is extremely important for people with post-myocardial infarction or coronary artery disease or even stroke. It improves the quality of life, it improves the mortality. الغرض منها مو بس it's about exercise or controlling risk factor. لا, you are changing the whole lifestyle of the patient. تمام؟ You control the risk, you control the diseases, you can improve the survival in the patient, improve the compliance to medication, implement program, smoking cessation, weight management. We كثير من الإيفيدنس على إنه patients with cardiac rehabilitation who go for cardiac rehabilitation, they have very high survival rate compared to those with who doesn't go for cardiac rehabilitation post myocardial infarction. Okay, so شكرا لكم. أتمنى إن شاء الله إنه استفدتوا. Any question؟ أحد عنده أي سؤال؟
دكتور أنا عندي سؤال.
تفضل.
الحين difference between الأنجينا وال MI إنه في الأنجينا ما يكون فيه complete blockage والبين يكون relievable لو أخذ نايتريك لو أخذ medications. أما في الMI يكون فيه complete blockage و the pain is not relieved.
Yes, exactly. فهذا البيشنت يجونا ب pain at rest. ليش at rest؟ لأنه كل شيء مقفل. كل شيء مقفل. Okay.
يعطيك العافية.
they don't have time أصلاً to exercise. ويبدأوا يمشوا علشان يشوف هم at rest they are having anginal pain لأنه there is no perfusion to the heart. تمام؟ أي استفسار؟ طيب إذا أحد عنده أي استفسار حاب يتواصل معي الواتساب most welcome. شكرا لكم. أتمنى لكم التوفيق إن شاء الله يا جماعة.